Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saracito is interpreting the press conference in Spanish. This interpretation will be available on the county's website and YouTube page shortly after we conclude this press conference. I'm very encouraged to report that I've seen increasing numbers of people wearing masks in public recently. I want to thank everyone who is hearing the message that masks are a critical tool in our community response to COVID-19. We can stop the spread of the virus by taking individual action that collectively protects each other. Increasing scientific evidence points to the benefits of wearing face coverings to reduce the spread of the coronavirus. Governor Newsom has mandated wearing face masks throughout California. Wearing a face mask covering does not replace the need to keep at least 6 feet of distance away from other people. It's very encouraging to see more and more people wearing masks outdoors as a sign of respect for others and to do their part to protect our community. The stakes are very high, and this moment in history requires extraordinary commitment from every resident of Santa Barbara County. Lives are at stake, livelihoods hang in the balance, our children's educational advancement is at risk. When we look back on this moment, we want to be able to say we did everything we could to help each other safely get through this very difficult time. Please continue to wear face coverings in public. Face coverings are very obvious in public settings. What isn't obvious is private behavior. The information gleaned from contact tracers who are interviewing every single positive COVID-19 patient in our community is that person-to-person infections among people we know indoors continues to be a very high contributor to community transmission of COVID-19 in our communities. Unfortunately, too many people continue to think their small, intimate group gatherings are not risky events. As a reminder, high-risk contacts occur indoors, closer than 6 feet apart, for longer than 15 minutes without masks. Mixing people from households who don't live together is a higher risk contact. Gathering people together outdoors for long periods of time also increases the risk of transmitting the virus. While we're encouraging everyone to reduce contacts to slow the spread of the virus, we're also facing another very serious threat. Our local economy is struggling as demand for goods and services has dropped significantly. Local businesses are facing very difficult decisions about keeping their doors open. Tens of thousands of our friends and neighbors have lost their jobs. Many more face serious financial hardship as the $600 a week COVID-19 supplementary federal unemployment insurance payments end later this week. Hopefully, Congress will pass legislation quickly and soon to address this very serious problem. If you're a local business owner that needs financial assistance, the federal Paycheck Protection Program has reopened for new applications. This federal business assistance program could provide needed financial assistance and support to keep local employees on the payroll. The Paycheck Protection Program allows companies to get direct government subsidies for salaries, rent, and other costs. Businesses have until August 8th to request assistance. These loans are granted on a first-come, first-served basis and are eligible to be forgiven completely if 60% of the funds go to employee salaries. Visit sba.gov to apply or for more information. The economic consequences of the COVID-19 pandemic could reverberate for years to come if we can't keep local businesses alive. Each of us makes decisions every day about where we spend our limited dollars. Please consciously think about how your discretionary dollars can support local businesses. While it may be convenient to shop online, local dollars that leave our community drain financial resources that could be recirculating in our local economy. It's obvious how we're all tied together in the public health fight to stop the spread of the virus. We're also tied together economically, and we need to work together to support local businesses. The ripple effect of business closures and job losses is very difficult to contain once the cycle accelerates. Even businesses that are seemingly stable right now can be threatened if other businesses that supply materials or services close. The restaurant that closes also hurts the bakery that supplies the bread, the local fishing industry, and the local farmers that supply the produce. Please do your part to support local businesses in any way you can. Shop locally, support local restaurants, use local delivery services, contact local businesses, and ask if they can help you shop virtually. You can support local businesses by requesting delivery, getting takeout, or buying gift cards. Every dollar spent here in our community helps. We'll now hear from Nick Clay, the county's Emergency Services Manager.
Thank you, Supervisor Hart. Today we are reporting 135 new cases. We have 295 active cases in our community, and 3,795, or 92% of those community cases, have fully recovered. Currently, 82 people are hospitalized, with 25 in the ICU. The state-run community testing program continues to adapt to the challenges of testing on this scale. In addition to our shift to a need model, the state has also made some adjustments in the testing process. These changes include opening up appointments for only 1 week at a time, as opposed to 2, as well as a more robust reminder campaign to reduce the volume of no-shows. We continue to ask those of you who have booked an appointment to cancel if you cannot make it for any reason. Again, please cancel your appointment if you cannot make it. One of the questions we frequently get is, who should be tested? If you can answer yes to any of the following questions, then you should consider being tested. Do you work in a high-risk environment where you have frequent interaction with the public? Do you live or work in a group living situation, such as an assisted living facility, senior living facility, group home? Are you an essential worker? Examples would include public service, grocery store employee, or utility worker. Has a healthcare provider advised you to get tested? Have you had close contact with a person confirmed to have COVID-19? In order for this situation to be considered a close contact, the following 4 elements must be present. Contact for over 15 minutes, with a COVID-positive individual and no one is wearing a face covering, or on either party, within 6 feet of each other in an enclosed space. And finally, do you have symptoms of COVID-19? Again, if you can answer yes to any of these questions above, you should consider getting tested. In response to the impact of community testing sites, the Public Health Department has developed a plan to enable those who need to be tested the rapid opportunity to get tested. These testing sites will not be available to the general public and only available to a small targeted population. We will be following the California Department of Public Health's Tier 1 and Tier 2 testing priorities. This includes close contacts of confirmed cases, which will be referred by the Public Health Department for testing, or those who fall into these high-risk groups, live or work in a high-risk congregate living facility, such as a skilled nursing home, work in a healthcare sector, such as those who in a hospital or a home health or hospice, and public safety and first responders. Registration information will be forthcoming in the next week, but I will caution that all those who register will be asked to validate their place of employment to ensure we adhere to the state's guidelines. Lastly, as we look to the months ahead, those normal milestones will look different. School and work will continue to be modified to support the mitigation of COVID-19. How we celebrate life's achievements and successes will also be different. The bookmarks of our year will be different. The only way forward is to remain hypervigilant. Oftentimes, the answer to the question of what can be done to move us in a positive direction, it's simple. Wear a face covering, practice social distancing, don't gather with those outside your immediate family, and keep good hand hygiene. The way forward begins and ends with each of us in our community. We must hold ourselves personally accountable to stop the spread. That means following the guidance and encouraging others to follow the guidance. It means we can't point to visitors spreading the virus. We have to point to ourselves. So in closing, we are the champions of our own cause, and we have to lead the charge by following this guidance. Thank you.
Thank you, Mr. Clay. Next, we have Mr. Stephen Delira, Deputy Executive Director from the Family Service Agency, here to talk about their efforts promoting hope, strength, and stability to Santa Barbara County children, families, and seniors. The Family Service Agency has been regarded as one of Santa Barbara County's most reliable and effective nonprofit human service organizations. Welcome, Mr. Clay.
Thank you, Supervisor Hart, and thank you to the public for listening in today, and thank you to the county for offering me to come here today and speak to the group. Family Service Agency provides services in Santa Maria, Lompoc, Santa Barbara, and Guadalupe. Here in the Santa Barbara area, we're just known as Family Service Agency, and in Lompoc as Family Service Agency. Santa Maria Valley Youth and Family Center, and Guadalupe we're known as Little House by the Park. Our basic needs is something that we provide to the public as well as mental health services. We have placed a new section on our website called the COVID-19. It's actually been there for a while now, but the COVID-19 section actually has resources that are available for you in the community. They have information regarding COVID-19, financial assistance, where you can go for mental health counseling, resources for seniors, housing and transportation, internet and social media, local and legal resources, homeschool resources, and child care. Our website is fsacares.org, and I invite all of you, if you can, to visit our website. Today I'd like to talk to you about some of the cultural norms that we're witnessing in the agency. And some of the norms that we're witnessing in the agency is that we weren't raised that way. So when grandma comes to visit from another state or for Mother's Day or even a high school graduation, and the families decide to come together for a celebration, often when we say there shouldn't be a social gathering of this size of a group or for this long of a period, we are told we weren't raised that way. I have been told we weren't raised that way. Some of the comments I've said to people have been, how do you mean? What do you mean we weren't raised that way? We weren't raised during a pandemic. How would we know how to respond? And generally that's a question to think about. We weren't raised during a pandemic. How do we know how to raise our children during a pandemic? Well, we're learning now. What we're learning now is social distancing, washing our hands frequently, and wearing a mask whenever we're outside of our home and we're going to be in public. This sense of cultural values being stronger than this COVID-19 that's going out there, or that's going on out there, seems to contribute to a higher number of cases of positive COVID-19 cases in the Santa Maria and Lompoc area from my perspective. Also, family taking care of family seems to be another issue that we have been addressing. So if a family member tests positive for COVID-19 and starts to show some of the symptoms, we may recommend that they put that family member in a hotel to isolate them from the family. The receiver is sometimes offended because the recommendation implies that they can't take care of their loved ones, and that's offensive. And so after we have a conversation about we had no intention to offend you. This was only an offer to help you through this period of time in your life and to be able to isolate your loved one from the family so that the virus is not spread. They generally will accept our apology, work with us, and decline the service. Another area that we see that seems to be problematic for us is multiple families living in a single family home. You can have anywhere between 15 to 20 people living in a house, and when somebody tests positive for COVID-19 and we ask for them to go back and advise the other family members in the house, they're fearful. The fear that they have is they'll be evicted or they'll be thrown out of the house, or that them and their family will be asked to leave the house. If you're living in a house where you're renting a room for you and your spouse and your 3 kids, being asked to leave is a hardship for you and your family. Where will you go? How will you survive? Generally, after we speak to them for a while, they're willing to go back to the residence and let the people know that they've tested positive for COVID-19 and what they're going to do as a family or as a family unit to heal and to get well. Those are just 3 of the areas that we're dealing with in Family Service Agency. There's a whole lot more, of course, but I wanted to speak to some of the cultural issues that we're dealing with in our agency. So thank you very much. And again, our website is fsacares.org, and I invite you to check out our website.
Thank you, Mr. Delira, for those very real-world examples and that message that goes with that, and for your many years of service to our community on behalf of seniors, families, and children in need. We'll now go to questions from the room. Ms. Lair?
Thank you. Before I get to a question, Mr. Clay, could you say the total case count? We keep wanting to add that.
Total case count, I don't have that exact number in front of me, but I can encourage you to refer to our website, which has those metrics as we have it today.
Okay. I'm wondering if all of a sudden outdoors seems safe enough for businesses, will there be a time that this press conference is held outdoors?
We are practicing social distancing in the room, and we have 6 feet of space amongst everybody. And we're doing the best we can to get the information to the public and keep everybody safe.
And also, I'd like to know if, you see this a lot online, people keep asking, do you know someone in the ICU? Do you know someone in the hospital? Do you know someone who has COVID? Could either of you answer that question? Has it hit home for you and your friends?
So I do have family who live out of state, and they have been impacted by COVID-19. They're elderly, so it's certainly something that's weighs on my mind every day until they get better.
Yes. So I have an aunt that's in a assisted living home or a facility, and they've had 19 positive COVID-19 tests. Thankfully, she's not one of them. I have a cousin whose husband worked at the federal penitentiary. He tested positive for COVID-19, as did she and the rest of the family. And then I have relatives that are in Texas where family members have tested positive, and a couple of weeks ago my aunt passed away from COVID-related symptoms
I'm so sorry to hear
right
that.
at home.
And I've spoken previously about family members who have had COVID-19. Any other questions? Okay. Next, we'll go to questions on the phone.
Yes, so first up is Laura Place with Santa Maria Times. Go ahead, Laura.
Hi, can you all hear me?
Yes.
Okay, my question was regarding the Country Oaks COVID-19 outbreak. And I saw on the metrics page for the county that the investigation has been completed or closed as of the 15th of July. And I was just wondering if you could clarify, what the investigation looked like, and, if a source of the outbreak was traced, obviously not the name of the individual, just if it was found to be brought in by a staff member or a visiting family member.
Certainly. So I can speak to the investigation. The word investigation may be a bit misleading. We're not talking about sort of looking for as a police investigation you would think of. It's really just that continual monitoring and continual investigative process to make sure that we have contained the disease in Country Oaks. So it's what that means is essentially they have stopped finding positive cases, and we would consider the course of COVID-19 over in that current facility at this point in time. With regards to how the case got in there, I don't have that data in front of me, but I would presume as the residents don't leave often, it would be a member of staff or a visitor that would have brought that in.
Okay, and would you also be able to speak a bit just to how communications have gone with family members, especially family members who have lost loved ones during this outbreak? Like, I know there's probably some obvious ones, like letting them know when they go to the hospital and all that, but I'm just curious what that communication has looked like.
So the facility has done, at least from what our estimation, has done a very good job in keeping the families up to date. It's challenging when you're not able to see your loved one, you can't go visit, you haven't been able to visit for a period of time, and you're only able to read what you see in the news. So we've been in close contact with that particular facility and many of the facilities in the county, and they are all working very tirelessly to keep their residents safe and their family informed.
Okay, and one last question. Are you able to confirm whether any residents from Country Oaks or staff members are still hospitalized or currently hospitalized?
To the best of my knowledge, the answer to that question is no, but I don't have that in front of me.
Okay, thank you.
Thank you, Ms. Place.
And next, we're going to Reza Georgie with San Ynez Valley Star. Go ahead.
Hi, everybody. Hope you're all doing well. I have a few questions. I've had some readers reach out to me and saying that basically, I'm trying to get accurate information. If somebody's tested, let's say today, Tuesday, and they test positive, then if that same person is then tested, let's say a week later, and test positive again, is that person counted as a new case, or are they just left off of your daily totals?
That's a good question. So we'd have to get back to you on the specific details of that, but I don't believe they would be double counted as a case, but they may be double counted as a test that's been conducted. But we can confirm that at our next press conference.
Okay, I would love to know that. And also, I've had a few people reach out to me saying that they've had appointments and they've canceled them, and then people are getting the notifications that their test is positive, even though they've never been tested, as they canceled their appointment. So how would they go about getting a correction to that discrepancy?
So I haven't heard that happening here in our county. If they do have those kinds of questions, there's really two avenues they can pursue. One would be to call, if it's from the OptumServe site, to call the 1-800 number where they booked the appointment, or it's listed on the website, to correct that issue, or equally they could call our call center to report that issue as well.
Okay. And then on the county's dashboard, there isn't information that I can see readily, especially on the daily totals of why there's no information on how many beds are available at the hospitals, how many ventilators are available, stuff like that. So is there somewhere easily, because I get the daily briefings from Cottage and a weekly briefing from Lompoc, but I don't have any, there's no media blast for Marion or any of the other, little places that people might be recovering at.
Certainly. So I can't speak to Marion's census. That's their process in which how they release that information. I can tell you we interact daily with the hospitals, and the hospital census number is a complicated number. It's a point in time when that data is collected. So they could report at 10 o'clock, it's a certain number. It changes from 11 to 12, 1 o'clock, et cetera. So it's challenging to report. So I think it's when you put that on the website, that changes frequently. So we can't speak to the fact that we are not on the state's monitoring list as a result of our lower than the threshold that's required to be on the state monitoring site. So you continue to look back and see if that changes, but as it stands today, it's not something that's being posted on the website.
And also, if you do go on Public Health SBC under the COVID-19 reopening metrics, there is a dashboard there that has the data for the county accumulated for hospital bed utilization and ICU bed utilization too. It's right there on the county website if you want to check that at publichealthsbc.org.
Okay, and then my last question is for Mr. Hart. What is the county doing to help local small businesses and individuals getting either a second round of PPP or extending unemployment benefits? Are you working with Mr. Carvajal's office or, Ms. Limon about petitioning our federal government for that?
Yes, as a matter of fact, we have a weekly legislative conference call with all of our state representatives and federal representatives from Senator Feinstein and Senator Harris's office, including Congressman Carbajal and Assembly Members Limon, Senator Jackson, Assembly Member Cunningham, to talk about current pressing issues that the county's facing, to work collaboratively with our state and federal legislators to address all of the issues that you described, from testing availability to the Employment Development Department, congressional action in regards to the Paycheck Protection Plan and extension of unemployment insurance. So we're doing everything that we possibly can, and our legislators are very responsive to those requests and are doing the best they can as well.
Thank you, Raisa. Next up, we have Tom Bolton with Newshawk, to be followed by Santa Barbara Independent.
Good afternoon. Thank you. I have two questions, and actually, I'm not sure if I can get either of them answered. Well, one of them, I'm wondering, we haven't seen Dr. Ansorg in a while, and I was figuring he might be here today since Dr. Del Reynoso is out of town. So I'm not sure what's up with that. But my question was, on Sunday, the county reported more than 1,600 cases, and yet the positivity rate was only 1%. And I've been trying to get an answer as to why that was the case, why they believe that was the case, because it's way out of whack with the positivity numbers that have been reported over the last few weeks.
I'm sorry, Tom.
Well, I don't know if anybody there can answer that.
What was the day that it was reported?
Oh, it was like 1,600 tests and 16 people were tested positive, which is a 1% rate. And that's just way out of whack with, any other day we've seen in recent weeks. And I did propose the question to the staff at Public Health, but didn't really get an answer to that.
Yeah, I can't speak to the specifics on that. I think it's going to vary day by day. We look at it as an aggregate as we look backwards and look at how this the 7-day trend is looking, and that's really where we focus versus the individual day.
Yeah, I get that. It just quite frankly, it seems unbelievable that you could have that many tests at this point with a 1% rate. So I was hoping to get some insight, but I guess I'll have to wait till one of the medical people returns. Thank you.
Thank you, Mr. Bolton.
Thank you, Tom. And next up, I believe it's either Nick Welsh or Jean Yamamura. Go ahead.
It's Nick Welsh. Hey, hi everybody. I got a couple of questions. The first one, could somebody explain the sort of contradictory nature of the numbers? We seem to be seeing a pretty significant drop in the number of active cases and a pretty serious bump in the number of hospitalizations. And it seems to be going in different directions. Can somebody explain to me what's driving each of them and how they seem to be going in opposite directions at the same time?
Well, I think it's the rule of statistics that, when you have large numbers, you have swings in the variability of the individual pieces of the equation. That it isn't always consistently large numbers of positive active cases translate into hospitalizations. There are individual patients that have individual medical circumstances that require individual medical interventions. And, sometimes there's a direct correlation, sometimes there's not. Sometimes there's more hospitalizations than cases. So over the very long term, those things average out to be more predictable and stable, but in the short run, there's big variations.
Okay, but the more important number there, I guess, would be the rise in the hospitalizations. And I'm wondering how concerned you are about that, how concerned we should be about it. And is there anything, that you can tell us about what's driving that?
So I would say that we are concerned about the hospitalizations. We're not alarmed, but we are concerned. It is a high number and it is putting, strain on the hospital system. To answer the question earlier about, the different numbers, it is a system. It's not one hospital operating on an island. And as a system, they are working closely together. They are working closely with public health. It's a very collaborative relationship. And the hospitals have the community's best interest in mind. And we are working with them on how do we ensure that we have enough capacity as the cases grow, and what do we do to sustain what we have now, but then work towards lower hospitalizations. So it is something that we are watching on a daily basis and communicating with the hospitals very frequently.
Well, on that score, and this will be my second to last question, on that score, do you have a number in mind where, you become not just concerned, but alarmed?
It's a good question, and I think that's really difficult to answer. As we mentioned earlier, the census comes and goes, and it's really hard to say at a particular point in time that when we hit X percentage of hospitalizations, that's going to be when we flip the trigger. It really is going to be a myriad of factors, and it's a constant conversation with the hospital about understanding what is our system capacity. Are we able to shift patients from one hospital within the county to another hospital? Do we need to move patients from this county, maybe this patient, to a different county in the hospital or in the state? So I think it's an ongoing conversation. It's a very complex answer. I wish it was simple that we could say when we get to X percentage, this is when things get really serious. But it's too many moving parts to have a singular point that we would focus on as that trigger.
Okay, last question. In your dashboards, you provide information as to how many health professionals along the way have tested positive. And I guess my question is, do you have a number right now for how many health professionals are active cases, are positive right now and can't do their job because of it?
So I don't have that data point in front of me. I do know that the number hasn't changed since July 9th, which would indicate if that stays the same, we'd have another week in which there are folks who are potentially impacted, but we have no new cases of healthcare workers since July 9th.
And you don't remember what the number was?
Well, it's 193 positive cases in total. I don't have the breakdown of where each employer is for all the positives at this point in time.
Okay. All right. Thank you very much.
Thank you, Mr. Welsh.
Thank you, Nick. And that concludes our question session.
Our next press conference will be Friday at 4:30 p.m. If you have any questions, please call the county's call center line at 833-688-5551. Please continue to practice these 3 simple personal steps every day. Remember to wear a face covering and stay at least 6 feet away from other people. Wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. If you feel sick, stay home and isolate yourself. If your symptoms worsen, call your doctor or clinic and follow their medical advice. Please continue to be patient, considerate, kind, and safe. We are stronger together, safely apart. Thank you for joining us today.